Hello and welcome to all of our Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold Learning and Gold Midwifery. And today I'm chatting with Dr. Mariana Colmenares Castaño. Welcome, Mariana. It's so good to have you back here at Gold.
Hello, thank you. Thank you for the invitation.
It is wonderful. You have been here with us several times at Gold talking about breastfeeding mostly. And this time you're joining us for the Gold Midwifery online conference and more specifically there on the add-on package titled Clinical Tools for the Changing Landscape of Newborn Care, that lecture pad you're part of. But before we go into the presentation and talk about that, you recently had a change of location, right, Mariana? You used to live in Mexico City, if I'm not wrong. And where are you now?
I live in London now. It was a big change.
A very big change.
Yeah, it is.
How are you enjoying the cold weather right now?
Nice. I think that it's interesting, but the weather is it's not bad. I like the English weather. I don't know if it's something that you always know that's not the perfect weather, but I like the changing things in the weather. I like it. I like the cold. I think that I'm less cold than many people from here, so it's weird. But yes, it's not bad. It's not bad.
Wonderful. Big change for your family as well. You know, you're settling over there and getting everybody moved over there. That's a big change. So tell us now, what is your role now?
I'm doing a clinical fellow in community pediatrics. Mm-hmm. It's I'm learning about working with neurodevelopment in children, and now I'm looking about autism and neurodevelopment things. So it's very interesting.
I can only imagine. It sounds very, very interesting. Yeah. Wonderful. So thank you so much for taking time out of that busy schedule that you have and all the moving that you just did and sitting down here chatting with me. You are a pediatrician, obviously, yes, and but you are passionate about lactation, breast and chest feeding, and you've made it your mission to educate pediatricians. So tell us a little bit about that background of yours. How did that all start? That as a pediatrician, obviously, you know, breast and chest feeding is important, but what made it so you took it as your life's passion?
Yes, well, actually, it was in 2009 when this pandemic of influenza was in Mexico, the first place, and I was pregnant, 20 weeks or something, and I was doing a subspecialty in one of the hospitals, the National Respiratory Health Care Center. So it was the center of influenza. So I was sent home being pregnant, and then I was professionally was very difficult, and emotionally was very difficult, because I wasn't able to continue what I was doing at the moment. No, there was pneumology, pulmonology, and things, respiratory things, and I started reading about parenting and about breastfeeding. And then when I opened the books and the research in breastfeeding, it really blew my mind. It was like amazing how I started to understand so many things, and I always liked that natural things, and I was always in that, but getting to know all of these that they never ever taught us as pediatricians or as medical doctors at school, never ever. It was I got mad. Actually, it was like, this is so amazing, why they do not teach it. It's like we know about cardiology and we know about nephrology. I have never ever seen many diseases of the kidney before. That we never see it, and we never see breastfeeding things. So I was really very passionate about the topic, and I started reading much more and preparing, and now I'm here.
Now you're here, and you're educating many students. You're educating,
Yes, I have a course.
You have a course. Yes.
I have an online course of breastfeeding. Is a 280-hour course online in breastfeeding medicine, and it's maybe 60 to 70% of them are pediatricians. There are many doctors. It's amazing. We have a nutritionist, and we have a midwife midwives, and we have nurses. So it's very, very rich, and it's amazing. We have trained around 250 healthcare professionals, almost all of them from Mexico, is in Spanish, but we have also people from South America. So it's really, really interesting, and it impacts a lot the way these healthcare professionals start to act in their own hospital. So I think it's really life-changing, because just with one person you support, you're really supporting a life, and that's incredible. No, it's always impactful.
And these professionals that you are educating, they're going, as you mentioned, back in their communities, into their hospitals, and implementing their, initiatives and education there. So it widens. I think it's wonderful. And probably now, when you look back and when you started, how little information was available, or how few professionals in your field were trained. Now it is probably changing, and because of you. Having such an impact there, right?
Absolutely. We started being 21 IBCLCs in Mexico, and we are now more than 100.
Yes.
So it has been changing really amazingly fast in the last years.
Fantastic. That's good. That's good change.
Yeah, it is.
Wonderful. So this year you have here with us for the Gold Midwifery Conference, as I mentioned, for this wonderful add-on package that we put together, clinical tools for the changing landscape of newborn care. We haven't done anything about the newborn in recent years, and I felt it was extremely important to dive into these topics. And your topic is there, the clinical assessment and management of jaundice in the newborn. Talk a little bit about that one.
Well, important because it's very common. It's need to do a correct diagnosis to prevent more important things to happen. No, these babies can be yellow and can be happy, but sometimes these babies can be yellow and can die. Or can have brain affected because of the levels of bilirubin. So it's very important as midwives or all the healthcare professionals that have contact with the newborn babies is to know the differences in between these yellow babies, and to know what to do and act quickly if it's needed, and not to act quickly if it's not needed. And obviously supporting breastfeeding always.
Yeah, it is, as you mentioned, it is very common, especially after 2 days of life, in the first 2 days there, it is. And it is always, it's a little bit of a tricky thing too, because you don't want to send a baby, back to the hospital if there isn't the need for it, right? Because that disrupts often the breastfeeding and of course the family as well, and so on. But of course, it's very dangerous or serious if it's not addressed, right? So to find that right balance to when is really number one, what is needed, what action is needed, first of all, to diagnose it, and then is there action supposed to be, and do we need to take action, and if so, what action, what is appropriate here, right?
Exactly.
Yeah. And so, as a midwife, what I've seen in my practice, and when I talk to other professionals, there's one thing that always comes up, and I know you probably will be talking about that in your presentation, is home phototherapy. We get that question so often: why do I have to go to the hospital if I could just do it at home? I know you will be addressing it, but really quick before I let you go, I would like to hear from you on this.
It's very interesting. It can be done. You have to choose these babies that are not high-risk babies, and these parents that are non-high-risk parents know that you can really, they can do acting quickly if it's needed, and that you can rely on them and what they do, and almost always you have to follow up very, very near to these babies. So if you have all of these together, then home phototherapy, I think, is an excellent option, not to separate and to continue this bonding and the skin to skin with a mother, and this breastfeeding and so many things that it's really, really useful. I have been using it in the recent years, and it's great.
Wonderful. Well, thank you so much, Mariana, for chatting with me here. I can't wait for your presentation coming up here that will be available February 6th. That's just around the corner. So thank you so much for coming here and chatting with me here today, Mariana.
Thank you very much. The pleasure is mine.
And for all of our viewers who would like to find out more about this presentation and the other presentation in the lecture pack and the Gold Midwifery online conference, I invite you to go and visit goldmidwifery.com. Thank you everyone for watching and have a lovely rest of your day. Bye-bye, everyone.